about complications, we have to think about a couple of things. First of all, what to do to avoid complication. And second, if it happens, how we can help patients. Because this is the, or maybe we have to name the complication itself, because what can happen, how to avoid it, and what to do if it happens, what we can do. First, very big topic, wrong diagnosis. So, if you treat something that shouldn't be treated, or if you avoid treating something that should be treated. Difficult to have a picture about it, but you know, the patient comes with the pain, and we try to do everything except endodontic treatment. But endodontic treatment was necessary because our mistake, we had to do something wrong. Or the other patients sometimes come with inflammation of the gingiva, gingivitis, sinusitis, inflammation of the maxillary sinus, and we are starting doing endodontic treatment without reason. So those complications can happen. Wrong access. Maybe what to do in previous situation. If you wrong diagnosis, how to avoid it? Be very, very careful. Do all the tests. Use X-ray. Use thermal tests. Talk with the patient about all this. Of course, it's better not to start endodontic, because you can start next week, for example, or next visit, than to start too early. Try to inform your patient about your way of treatment, and it could be the best. Wrong access. The pictures are pretty good. So if you try to do it, of course you can miss the pulp, you can destroy it. When it happens, in very big for beginners, so be careful because you are beginners. And second thing that can happen, unfortunately, when you're using rubber dam. About rubber dam, we can have a separate topic about the good and bad things. Unfortunately, among students, much more often happen that you get lost where exactly chamber is, where the canal should be. So perforation or wrong access can happen because you're thinking you are in the proper way, but in fact you are somewhere. So be very careful that access point is proper, that you drill in the proper place, and measure the X-ray, how deep you should go to be safe. If it happens, what we can do? Sometimes we can rebuild. We can, like in this case, we can clean. We can cure the perforation. We can rebuild the wall, and then try to find proper place. Perforation, similar like the previous, that you work not proper. You used to do too huge instrument, too huge power to try. You want to be too fast. Sometimes you don't use proper instrument that cannot be curved, like but it goes straight, or goes straight this way. If it's perforation above the gingiva, we use it like normal caries, so it's easy. We can just replace by the composite and nothing happens. If it's done in the radicular part, we have to use proper material, MTA, for example, to block it. It's not easy. It's not easy even for its doing that. Perforation. If you try to look for the canal in molars, Sometimes it happens that you make a call. You try to think here is the orifice, but it's not. How to recognize if it's perforation or it's beginning of the root canal? Any ideas? Like in this first picture, it's something red. Is it perforation or it is the beginning of the chamber of the canal? How we can recognize it? Any ideas?
It shouldn't be blood.
Sorry, once again.
There shouldn't be blood. So there's a bunch of blood.
No, in both could be blood. If you've got pulpitis, there's a blood in that canal, and there's a blood in the periodontal tissue. So no, it could be blood in both. What we can do? Because if the perforation is very, very small, usually you can put MTA, sometimes even GIC with calcium hydroxide, and usually it's perfect. If it's huge, sometimes it's the only extraction. So if you are not sure.
Would the patient feel pain?
In both?
No, because if you perforated it, wouldn't they feel more pain? Even if they are numb?
No. Both could be painful. If you put anesthesia, everything is painless. If you not put anesthesia, a live pulp in the root, in the canal, or a live periodontal tissue in the bone, in periodontal space, both could be painful. Good ideas, but unfortunately not. Something else. There is one equipment that could be useful in such case. We can use apex locator, endometer. If you go inside the canal, the apex locator show you that you are in the canal. If you touch periodontal tissue, if you touch periodontal tissue, there's perforation, you will have information you're in the apex. Because the electricity flow is the same that you're in the periodontal tissue. Of course, not 100% situation, it gives you perfect results, but usually it's a good idea to help in this case. If you are not sure, endometer should give you proper answer. Root canal perforation, as I said before, much more difficult. The same situation. If you apex locator gives you that you are in the canal, and here gives the information you're in the apex. Yeah, because the electricity flow will be similar. The other perforation, in this case, it's maybe perforation because of the not endodontic treatment on this picture, but somebody tried to put some post, but with no perforation. Hypotheran, dangerous situation. If you, as you remember, hypotheran, even from the previous lecture, can easily destroy the live tissue. So if you put it to the periodontal tissue, it will destroy a live tissue. Very, how to say, bad complication. because it's not very nice. Patients don't like it. Very nice. Usually look like will be beat by somebody. What to do to avoid? Don't use strike needles, just endodontic needle. Don't use very strong pressure when you're in the canal. Prepare the canal proper way. That should be, don't destroy apical construction. The canal should be wide, but apical area should be very, very tiny. If it happens, what to do? Usual could be sent to the hospital just to be in Lubin's situation. You can say send it to maxillofacial surgery. Usually antibiotic should be treated because the tissue destroyed by hypochondria can be easily infected by bacteria. The treatment sometimes takes a couple of days or even weeks. Of course, it depends how serious it is. Is it a common situation? I remember once we got one of my students. It wasn't very serious, but patient usually feel pain very, very strong. Emphysema. So you press air to the tooth to the structure. Is it common situation? No, very rarely. As I remember, my situation happens once to me, but it wasn't during the endodontic treatment. It was some periodontal treatment. Patient, it's very unlikely because what is going on? The air is inside the soft tissue. Patient feel like he's got some bubbles inside. It doesn't look nice, but finally it's very, very easy to treat. Generally do nothing. It is treated by itself pretty quickly in a couple of days without any complications later. What to do to avoid in an endodontic situation? Don't dry canal by air. If you put air from this air water syringe and press it, try to dry the canal by it, you can easily press the air to the soft tissue. Complication with obturations. Overfill the canal. It happens. What to do to avoid? First of all, try not to destroy apical construction. Not to use too high forces during obturation. Not to use too much sealant. If it happens, sometimes observation is enough because our body can remove and resolve it even with some sealant. If it's not, sometimes resection is necessary. Of course, situations that you can see here happen very, very rarely, but in this case it could be very serious complication because the sealer is fixed, is located to the mandible canal. So it can even irritate nerves. Incomplete filling. This part we can use it to the group of complications, but isn't really complication if you can remove the good aperture and put it once again the whole length. Everything is done proper. That's why, for example, if you obturate the tooth and you've got such a thing, you take an X-ray. You know it's not complete filling, so you just remove the aperture, shape the canal 2-3 millimeters longer, and fill it once again. In such case, it's difficult to say that it's complication. It's just not finishing of endodontic treatment. But if you leave it for some reason, then yeah, it is. The most when you talk about complication of endodontic treatment, I think the first idea everyone has is fracture of the instrument. Is it happen? Yes. Every endodontist leaves some or even many instrument in the canal. Is it something really dangerous? It depends. And what to do? This one. Maybe how to avoid it. 100% it's not possible because sometimes even new instrument can be easily destroyed if the canal is very narrow or it's curved sometimes. Of course, try not to use very old instrument that was used many times, that was bent many times. Then of course it's the chance that it will be destroyed is much higher than in normal situation. But if it happens, what to do? First of all, you have to think what is the stage of this treatment. So, if you break the instrument that you put the infected canal, imagine you've got some inflammation or maybe pulp necrosis, you try to remove the rest of the parts, you put first Barber's broth and it's broken. Of course, such instrument must be removed because around and under this instrument there are a lot of infected tissue. But if you break dental spiral during obturation, there is no sense to remove it because we can use it as a part of the obturation material. There was lentula, the canal was prepared, everything was clean. In such case, we can leave. If it happens in the middle of the treatment, sometimes we have to think, is it possible to go around this instrument, clean it, and proper operate it? If yes, you don't have to remove it. If the instrument is blocking the canal and cannot do the proper endodontic treatment, the instrument must be removed. We can remove it. It's very difficult to do it, to try to find all details, but how to grab, how to take this back, it's not easy. If it's not possible, sometimes resection is the only option to take. Discoloration happens not very fast, but pretty often. The tooth after endodontic treatment, after a couple of years, start to be more dark than the others. First of all, it's because the color, because that tooth hasn't got enough proteins, enough minerals to rebuild itself, so it's different. Moreover, some of the sealers, some of the material used during the treatment can discolorate the tooth. What we can do to avoid? Well, don't destroy the whole crown during the treatment. We are using hypochlorite to have bleaching effect. When you finish obturation, clean the crown, clean the chamber very carefully to leave endodontic materials only inside in the crown. as I said a couple minutes ago, that rubber dam could be a problem because you lost concentration and you don't know where you should drill. In this case, rubber dam is very good idea because it can easily block all instruments from the floor. I've got a in lying position without rubber dam. In sitting position, it depends. I know that in some countries there's a rule that rubber dam must be used. In Poland, many doctors work without rubber dam and don't do treatment. But for sure, it's a big position. Not in lying, because if you drop anything, it goes immediately to patient's throat and then to the other organs. What to do to avoid some problems? For sure, magnification can help you to see much more details to avoid some complications. Loops, microscopes, proper ergonomic position, just to be sure that everything is done properly. Okay, do you have any question about the second one, about dental endodontic complications?
No questions.
So just to summarize, endodontic is beautiful, but the danger part, of course. You cannot be very hurried because then it's very easy to make some mistake. And complications will happen. It's not possible to avoid all of them, but let's try to reduce the number of them. And moreover, every time something wrong happens, remember to explain to your patient that such a thing happened, because it's possible, it is complication, happens. Much bigger problem will be if you try to hide it, the patient don't know what's going on, and the patient will find it next visit in the other dental clinic that something goes wrong and you make some mistake. Moreover, if something wrong happen, remember to explain to patient what he can do to reduce those problems. Yeah? In every part of it, I try to tell you what to do, how to help your patient, how to remove, how to heal, or whatever, different complications. So the same, if something happens, tell about your patient and explain what to do to avoid serious problems with it. Okay, so that's all for today. I will prepare